Special coverage.
Balik po tayo sa I Am Ready sa Double B. Alas 9:20 na ho ng Sabado ho ngayon. 2 na ho ng Mayo 2020. Ano nyo, bago
Ito yung sila na Marcos, ano yung company, wala pa rin yung
Yun.
Pag sinarakap dito sa kuan, yun na. Sa COVID ward. Siyempre nagsarami na outside mahubing na ano. Nasa COVID ward na papa. Ano? Sa'yo magpapag-isip.
Administration and Governance webinar by the Department of Interior and Local Government and the Philippine Society for Public Administration. I am Lizan Kalina, your moderator, as we discuss the imperatives of leadership, governance, and innovations within the context of the new normal. As we all know, the fourth industrial revolution is also considered as the knowledge era. That's why knowledge is power. Knowledge is an unlimited resource compared to other resources like property, money, and even power. In many publications, knowledge has been tagged as the new oil. That's why this morning's knowledge co-creation will focus on the importance of health governance, particularly on the expanded COVID-19 testing. We will locate our discussion within our health systems framework with the help of our experts who are all medical doctors from national and local governments. Before I start, let me acknowledge our participants from different institutions, private and public organizations, local government units, universities, and colleges. I was informed that we are also joined by our colleagues from the United States, Germany, Thailand, Indonesia, and Taiwan. And to start with, I would like to acknowledge our DILG Undersecretary, Jonathan Malaya, for his opening remarks. Sir?
We have foreign participants. I think I have to speak in English. I'd like to express my thanks once again to our partners from the Philippine Society of Public Administration led by Dean Lizan for continuing to work with the Department of Interior and Local Government in spreading the correct information about COVID-19. This time on the subject of expanded testing or COVID-19 testing, which is very important for our local government units. So I'd like to welcome all of you today, in particular our stakeholders from the local governments who are participating in our webinar on expanded testing. But just the same, I'd also like to thank Undersecretary Rosette Vergere for always accommodating our requests from the department to join us in events like this. We have been working very closely with the Department of Health since January under the umbrella of the IATF for the management of emerging infectious diseases. And we will be with all agencies of government together with our private partners until the end of this crisis, which I think will happen as if we work together in this regard. I'd also like to acknowledge Dr. Olga Vertuso of the Parañaque City Government, Dr. Alberto Herrera, also of the Marikina City Government, and Mayor Lacambini Reluya of the City of San Fernando, and the various board of directors of the Philippine Society of Public Administration, and Dr. Alex Brillantes, my idol, who is the president of the Asian Association of Public Administration, and of course, former Dean Fem Mendoza of the UP National College of Public Administration and Governance. So I will not take a lot of time because we want to go straight to the topic, and I'm sure that Undersecretary Rosette Vergere is so busy, one of the most hardworking government officials in the country today. So, but just the same, I hope that you will continue to support the DILG and this common activity with our partners from the PSPA as we spread the right information about COVID-19. This will be a continuation. We will do more webinars, utilizing the latest technology available to us so that we can discuss and inform our local government officials and our partners of how to defeat this COVID-19 utilizing the national strategy adopted by the National Task Force Against COVID. Again, maraming salamat po. Dean Lizan.
Yes, maraming salamat, Yusek John. So before we proceed, I'd like to introduce our resource persons. We have 3 RPs right now. One is from DOH, that's Yusek Vergere, and 2 from the local governments, Dr. Olga Vertuso and Dr. Alberto Herrera from Marikina City. And for our reactors, we have Dr. Alex Brillantes, Mayor Reluya. We'll be joined later on by Dr. Michael Campued, Dr. Maria Fe Mendoza, and Dr. Gary Ador Janisha. So I'd like to introduce our first resource persons. Oh, by the way, we will give 15 to 20 minutes for them to maximize our time. And after that, we'll have our open forum. So our first resource person is highly in demand because you always see her on TV. So friends, please welcome Yusek Maria Rosario Vergere of the Department of Health. Ma'am, good morning.
Magandang umaga po sa inyong lahat. Good morning, ma'am. Thank you very much for inviting us in this endeavor, and nagpapasalamat po kami kay Yusek Jonathan Malaya Totoo po, katuwang namin siya mula pa nung umpisa, nung maliit pa po ang grupo ng IATF, kami po ang nagkikita-kita lagi doon, no, na nag-umpisa nitong lahat ng ginagawa natin sa ngayon. Gusto ko magpasalamat sa lahat ng nandito ngayon, mga local government units. Alam ho namin ang importansya nyo dito sa ating response na ito. Kaya, Yusek Malaya, hindi po kami magsasawa na sumama sa inyo sa mga ganitong pagkakataon dahil gusto ho namin kumalat ang tamang informasyon para sa COVID-19 response. So kung mamarampatin, mag-uumpisa na po ako ng aking presentation. Ito pong presentation natin ngayon ay para lang ipaliwanag at maging klaro po sa ating mga kasamang local government units and also the other sectors kung ano po ang ginagawa natin sa Department of Health together with the other national agencies. Next please. So ito lang po yung outline ng discussion natin for today. I will be discussing the sectoral strategy and the general principles of COVID-19 response. The next would be, ano po nga ba yung mga guidelines natin for our local government units, the science behind policy and implementation, direction, and of course, the implementation strategies to deliver our people-centered response of preventing, detecting, isolating, and treating. Next, please. So you'd find in this slide, medyo marami pong nakalagay, no? But basically what it says would be, our major goal is to reduce COVID-19 related and non-COVID deaths. So mapapansin nyo po, bakit ba tayo merong non-COVID deaths? Kailangan po natin alalahanin at kailangan po nating bigyang importansya ng iba ho nating kababayan ay hindi lang COVID ang kanilang nararanasan, kung hindi, meron din po tayong pa rin, no, na mga non-COVID related na mga nangyayari sa ating mga kababayan. So, our goal is both to focus on COVID and non-COVID deaths. So, ano ho nga ba itong mga strategiya na sinasabi natin? This 5-point strategy. So, we have 3 strategies to address the prevention of cases. Ito po yung unang-una, increasing resilience, which starts with the individual itself. Kailangan malusog tayo, kailangan malakas ang katawan natin para tayo ay nakakalaban sa sakit na ito. Ang pangalawa is stopping transmission. Ito po yung mga ginagawa na po natin na non-pharmaceutical interventions, no, na sinasabi natin, we wear mask, we practice regular hand washing, nagtatakip tayo ng ilong at bibig kapag tayo ay umuubo o bumabahing, o di kaya ay ang pananatili natin sa bahay. Ang pangatlo po, we reduce contact rate, no? So yun pong sinasabi natin na kaya tayo lahat nasa bahay, kaya dapat may physical distancing kasi alam natin ang transmission na ng sakit na ito is through droplet infection. Kaya kailangan magkalayo-layo tayo. And of course, meron tayong mga tinatawag na engineering and administrative controls na ginagawa rin para further reducing contact rate. And then the fourth one, and the fifth one would be for us to detect, isolate, and treat. So kailangan kapag po na tayo ay nakapag-trace na ng contacts, na-detect natin ang isang tao na merong positibong kaso, kailangan napaka-importante na nahahanap po natin lahat na nakasalamuhan ng pasyenteng ito. So we trace the contacts, we test them, and then kung sakasakali po, kailangan, no, napaka-importante. Ang lagi pong sinasabi ng ating mga kababayan, wala pa kasing test kaya hindi ko pa mabibigyan ng aksyon. Mali po iyon. Kahit wala pa hong test, alam ho natin may simptomas, may exposure, i-isolate na po natin. Yan po yung ating pinaka-importanting magagawa because with that, we can lessen the risk for transmitting and also shorten the duration of infectiousness. And of course, pinapatupad na ho natin ngayon ang telemedicine para po hindi na lalong makapanghawa-hawa. Gusto natin ang ating mga kababayan ay sa bahay na lang po at doon na lang po kukonsulta through telemedicine sa kanilang mga doktor. And we like to enhance quality, consistency, and affordability of care provision. Meron na po tayong mga guidelines na pinatutupad ngayon. Meron na po tayong iba't ibang off-label drugs na ginagamit natin for our protocols for our trials na sinasabi. Meron na ho tayong mga infrastruktura, meron ho tayong mga ambulansya, and of course, we like to ensure na safe po ang ating healthcare workers. We have regular supplies of PPEs, and meron na ho ang PhilHealth na na-develop na benefit package para po sa kabuuan or spectrum ng panggagamot para sa COVID-19. And of course, pinaka-importante pa rin sa atin, we have to retain the non-COVID pathway. Ibig sabihin, yung mga essential services natin na dati pang naandyan ay hindi dapat mawala. Next, please. So these are just our strategic directions. This is the guiding principles for the new normal. Marami pong nakakarinig sa atin ngayon. Araw-araw, meron po tayo yung sinasabing new normal. Kasi alam po natin na kahit po na mapahaba natin ang ating pagdodouble ng mga kaso, kailangan na po nating i-imbibe sa ating mga sarili itong new normal na tinatawag natin. Para po natin magawa iyan, we have these guiding principles. First would be, dapat ang ating response should be whole of government, whole of system, whole of society approach. Lahat tayo tulong-tulong, lahat tayo sama-sama. Ang lagi nga naming sinasabi, wala na pong public at private ngayon. Wala na pong national at local. Kailangan magkakatulong, magkakasama. Wala na po tayong tinitignan ng mga differences. The next would be, yung science po should inform our decision making, not just at the institutional but also at the individual level. Lahat po ng ginagawa nating decision ngayon, dapat may ebidensya, dapat may siyensya. The third is recognizing limited resources. Response shall be guided by fair and transparent priority setting. Alam na po natin na hindi naman po marami ang resources ng Pilipinas. Kaya nga po tayo ngayon, pag nakikita nyo, we always have this priority setting kung sino yung pinaka-vulnerable, yun po ang inuuna natin. And of course, in any event na meron po tayong hindi pagkakasunduan, kailangan yung human dignity and the safety and needs of the individual shall always prevail. And with these guiding principles na ipapatupad po natin ang ating National Action Plan strategies, which is to detect, to isolate, and to treat. Next, please. So ang ating strategic direction, kailangan po alam natin kung ano ang ating mga roles dito sa ginagawa natin. And we all know that the national government would always act as the enabler. So ito pong ginagawa natin, this is a national government enabled and most importantly, local government unit led. Ibig sabihin po, ine-enable lang ng national government ang environment, ang mga kailangan para ang local government unit po ay maisatupad. Ito pong mga polisiya, ito pong mga pamantayan na sinasabi natin for this response. And what would be important also, kailangan people-centered ang ating response. Next, please. So with this, gusto lang natin ipaalala sa lahat na ang national government po, kami po ang gumagawa ng mga national plans, policies, strategies, yung mga regulatory measures para po maisatupad natin ang mga standards para safe po at saka epektibo ang mga binibigay nating mga gamot o kaya ay mga facilities na pinupuntahan. Also, nagmo-monitor kami, nagbi-build kami ng capacity. But local government unit, most importantly, are the primary responders. Sila po yung stewards ng local health system at sila po yung magbibigay sa atin at magbibigay sa ating mga kababayan nitong pag-aalaga para sa kanilang health dito po sa hinaharap nating pandemya. Next, please. So with this, makikita lang ho natin yung mga struktura. Gusto lang ho namin ipaliwanag para hindi tayo lahat naguguluhan. Local government units, sila po yung sa implementation and service delivery. Now for national government po kasi, meron po tayo mga structures like the National Task Force through its task groups. This is led by our Secretary Galvez, na na-appoint po ng ating presidente. Sila po yung enforcement, sila po yung nagpapatupad, sila po yung nagro-roll out ng mga plano, sila ang nagmo-monitor, they mobilize resources. As with the IATF po, with all of these national government agencies included, ito pong IATF natin, sila ang nag-iisip, nag-aaral, nagbibigay ng mga strategies, ng mga guidelines, ng mga standards, at saka po yung ating mga impact monitoring na sinasabi. So just for the clarity of all of these structures that we have right now, IATF lays out the policy and the strategies. Yun pong National Task Force through the different task groups, sila po yung nagpapatupad. And of course, local government units shall do the implementation and service delivery. Next, please. So medyo magulo po itong slide na ito pero napaka-importante po ng mga slide na ito dahil makikita po natin yung mga patient pathways na tinatawag natin. Tumingin po tayo sa gitna, makikita po natin sa pinakataas ang ating families ng individuals kung saan nagmumula ang ating mga dito nagmumula ang ating pathway. And ang gusto nga natin, ang sinasabi natin, lahat dapat through telemedicine. So wala na pong pupunta sa ating mga primary care units para makaiwas ng paghahawa-hawahan kung sakasakaling may nararamdaman. So it is through telemedicine at sasabihin sa telemedicine kung ikaw ay non-COVID or COVID. So pag non-COVID po, ang ating navigator are the barangay health workers. So maaari pong i-refer ng ating barangay health workers sa ating primary care facilities like yung mga RHUs, BHS, or private clinics kung kinakailangan at maaari ring i-refer sa higher level of care kung kinakailangan. Pag sa COVID-19 patient pathway po natin, yung atin pong barangay health emergency response team ang gumagana po dyan. This is led by our municipal and city health offices, the mayors also, and then we can, no, kung halimbawa siya ay probable, siya ay suspect na mild or probable mild, o kaya ay person under monitoring, maaring i-refer ng births natin sa ating temporary treatment and monitoring facility na merong individual rooms and toilets, katulad ng mga ligtas COVID-19 centers natin. Maaari rin kung nakapag-test na at confirmed naman at mild siya, maaari na rin dun sa ating mga mega facilities. At kung sakaling may severe siya na mga simptomas, sa ating mga referral hospital siya dadalhin. At kung sakaling makatapos na siya ng kanyang gamutan at siya ay nakarecover, maaari na pong dalhin sa step-down care sa mga level 1 hospitals natin kung saan they would stay for another 14 days to quarantine. So ano po ba yung mga kailangan gawin? Dito po sa kaliwang bahagi naman ng ating slides, what are the must-dos for local government units? Of course, kailangan natin makapag-trace po ng ating mga contacts. Kailangan matest natin ang mga contacts na yan, may isolate at quarantine, and of course, we have to manage the cases. Dito naman po sa kanang bahagi, makikita natin yung mga suporta na mga services na meron tayo like the subnational laboratories. And of course, kapag ginamit po yung rapid antibody test, kailangan merong lisensyadong doktor na tutulong sa pag-i-interpret ng resulta na ito. Next, please. So this is just to show you our case classification para po naiintindihan ng lahat at pare-pareho tayo ng sinasabi at pagkakaintindi. Ang importante po dito, kailangan po na maintindihan at maalala, no, na exposure at symptoms ang kailangan alam natin. So dito po sa slide na ito, makikita natin ang exposure sa columns at symptoms sa rows. So the first row would show you yung with symptoms. So kung halimbawa may simptomas tapos mayroon siyang exposure, maari siya ay suspect kasi meron siyang simptomas at nakikita natin, and yun pong kanya mga test ay inaantay lamang at hindi pa nakukuha or itetest pa lang siya. So maaari na siyang i-classify as suspect. Kung sakali na siya ay suspect na pero ang kanyang resulta ay sinasabing inconclusive. Pag sinabi po nating inconclusive ang resulta, ibig sabihin ay maaaring ang ginamit ay rapid antibody test o di kaya meron siyang equivocal result. No, meron ho tayong ganun sa laboratorio kung saan hindi ma-determine kung ito ay positive or negative. So kailangang ulitin. O kaya hindi talaga magawa ang test kung ano bang rason ang meron. So this is a probable case. And we have the confirmed case which is who are tested positive. Ngayon po yung probable na yan, ito po ay kinokonsidera na rin nating confirmed kapag tayo ay nagmamanage ng cases o kaya kapag namatay, kapag nagmamanage tayo ng deaths. So ito pong probable, nung nagkaroon tayo niyan, it legitimized yun pong ating panggagamot ng mga taong walang test pero mukha talagang COVID, o di kaya it legitimized yun pong pagtitreat natin sa remains ng mga namatay na walang test pero mukha talagang COVID. So probable and confirmed, ang difference lang nila is yung test po na resulta na wala ang probable. And of course, those without symptoms but with exposure, they are our persons under monitoring. So hindi po totoo na nawala ang ating PUM sa ating mga pagka-classify at paggagamot or manage ng ating COVID-related health situations. So next please. So ito lang po yung ating local contact tracing teams. Ito po ay naipalabas na, nagkaroon na rin po ng joint policy issuance ang ating DILG at saka ang DOH kung saan in-institutionalize po natin ang mga ganitong struktura at nakapagbigay tayo ng ating mga pamantayan. Dito po yung local contact tracing team structure. Ang ating pong lead dito ay ang ating city or municipal health officer. Co-lead po natin dito ang Philippine National Police. So marami ho ang nagtataka, bakit ba kasama na natin ngayon ng mga kapulisan sa pagko-contact trace? Ito po talaga ay hiningan natin ng tulong, no? Para po tayo ay lalong magkaroon ng stronger na contact tracing. Humingi tayo ng tulong sa DILG para tayo ay matulungan dito po sa pagsasagawa ng contact tracing. And of course, under this steering committee, nandyan po yung iba't iba nating mga BERTs. No? Ito yung mga Barangay Health Emergency Response Teams, which are composed of the different healthcare professionals and other offices within the local government units like Bureau of Fire, kasama dyan. Meron po tayo mga volunteers also and the disaster risk reduction staff na nandyan din po sa ating mga local government units. Next, please. So ito naman pong for case detection. No? So napag-usapan natin kanina yung sa management po. Ito po, COVID-19 expanded testing. No? So dito po, gusto lang naming bigyang linaw. Ang expanded testing po ay ayaw naming tawaging mass testing. Bakit nga po? Kasi pag sinabi nating mass testing, baka isipin ng mga tao, we can test all of our 100 plus million people in the Philippines. We should not do that. It does not mean testing all individuals, but testing only who are at risk of COVID-19 infection. Next, please. So ito po, pinapakita lang ng slide na ito kung paano po natin pinaprioritize ang ating mga individuals with COVID and also the different subgroups, no, for our prioritization. So ang subgroup A namin at saka subgroup B, ito na po yung dati pa nating ginagawa at priorities natin for testing. Kaya nga po na nag-umpisa yung subject na expanded testing, sabi namin, dati pa naman natin ginagawa yan. This would just be progressive. Ibig sabihin, as our resources would be there and sufficient na, maaari na nating i-include yung iba nating subgroups para makumpleto natin lahat ng individuals na nangangailangan ng test. So subgroup A would include patients or healthcare workers na merong severe or critical symptoms at meron siyang relevant history of travel or relevant history of contact or exposure. Subgroup B would be patients or healthcare workers with mild symptoms, with relevant history of travel and contact, and considered vulnerable. So ito po yung mga vulnerable natin na dati pa nating sinasabi, ang matatanda, ang ating mga tao or patients with pre-existing conditions katulad ng diabetes, high blood, may cancer, may HIV, at yung iba pa hong nakakababa ng resistensya, at yung ating mga buntis at mga healthcare workers ay kasama rin sa vulnerable group. Ang subgroup C po, ito po yung mga may mild na symptoms ng mga pasyente or healthcare workers, merong history of travel or contact. Pero sabi natin, magagawa lang po natin ito dahil nga sa kakulangan ng ating resources kapag umabot na po sa 8,000 ang capacity natin for testing. And the subgroup D would be our persons under monitoring na walang mga simptomas pero may history of travel or contact. And we can do this once our capacity exceeds the 8,000 capacity for testing. So makikita nyo ho, gumagawa tayo ng priorities because of our resources. So sa ngayon, ang high priority, subgroups A and B, ang ating low priority, subgroup C and D. Pero hindi ho natin sinasabi na porke low priority ay hindi na natin sila i-manage. Halimbawa, makakuha tayo ng isang pasyente, may mild symptoms, may history of travel and contact, ngunit hindi pa rin natin siya ma-test, i-isolate na ho natin ang pasyente. Huwag po tayo mag-aantay na makakapag-test pa bago tayo gumawa ng aksyon para po maunahan na natin at ma-prevent natin ang further transmission ng sakit. Next, please. Ito lang po yung gusto naming ibigay para sa kaalaman ng lahat. Ano po ba ang difference ng RT-PCR-based test kits at yung ating rapid antibody test? So, in terms of diagnosing, ang RT-PCR po ginagamit natin sa symptomatic individuals. Ibig sabihin, yun pong mga pasyente o mga individuals na mayroong mga simptomas. At ito po namang rapid antibody test natin, ginagamit po natin, no, ang gusto nating iparating sa lahat, hindi po siya ginagamit for diagnosis. Kasi po ang rapid antibody test natin, ang meron siya antibodies, no? Only RT-PCR can tell you if you are COVID positive or not. Ang rapid antibody test po ang ibibigay sa inyo kung ano po yung mga antibodies na nabuo na sa loob ng ating katawan because may sakit tayo. And itong rapid antibody test, lumalabas lang po itong mga antibodies sa katawan natin, especially for early infection, yung tinatawag nating IgM. Ito po lumalabas lang mga 5 to 7 days kapag nag-umpisa na yung sakit natin. So this is prone to false positive and false negative. Kasi po, maaari na itetest natin yung walang simptomas o kaya nag-uumpisa pa lang ang simptomas at maaari magkaroon tayo ng false negative. Marami rin hong nagkakaroon ng false positive. So nakakatakot din dahil maaari pong itong mga false positive isasama natin doon sa mga positibo nating kaso na totoo sa ating mga facilities at maaring mahawa pa sila dito sa mga pasyenteng ito. Nagagamit po natin itong rapid antibody test dun po sa ating patient subgroup D. Maaari nating gamitin, ngunit kailangan pa rin na i-validate natin with RT-PCR. Yan po yung nasa protocol natin. So pag sa discharge po ang RT-PCR, hindi na ho natin inaantay para po masabi natin kung i-discharge natin ang pasyente o hindi kung meron tayo mga test. So hindi naman talaga ginagamit parehong ito. And then the determination for full recovery, ang RT-PCR po hindi. Ito pong rapid antibody test, nagagamit po siya kasi pag lumabas na po yung immunoglobulin G, which is a more, parang sinasabi na it's a form of recovery na para sa pasyente kapag lumabas po itong IgG natin sa pasyente. Next please. So ito po yung ating case detection for rapid antibody test. Ito lang yung mga kailangan malaman ng ating local government units. Unang-una, it shall not be used as a standalone test to definitely diagnose or rule out COVID-19. So sabi ko nga po sa inyo, ang lumalabas po sa test na rapid antibody ay antibodies. Hindi po niya sinasabi kung kayo ay positibo o negatibo sa COVID. So marami pong limitasyon ito pong test na ito. Kaya kailangan kung magkakaroon kayo ng resulta sa rapid antibody, i-validate nyo po iyan with an RT-PCR based test kit. Now, kung ginawa naman po natin to, kailangan naman maging considerate tayo. Kailangan maging rational tayo kasi baka maubos naman po yung RT-PCR test kits natin kasi kaka-confirm natin with this rapid antibody test. Number 3, reporting of confirmed and recovered cases shall continue to be based on RT-PCR testing. Ibig sabihin po kasi nga po, ang rapid antibody test ay hindi po siya yung gold standard. Lahat po ng nire-report natin na positibo o di kaya nakaka-recover ay base lang po sa RT-PCR testing. The 4th, only rapid antibody-based test kits approved by FDA and locally validated by RITM or DOST ang kailangan gamitin. Pero nagbigay na ho ng deklarasyon ang ating presidente nung isang araw na basta approved ng FDA, kahit wala pa yung validation, maaari nang gamitin at isusunod na lang natin ang validation done by RITM or DOST. Next please. So kailangan din po, lisensyadong doktor ang mag-i-interpret nitong test kits na ito. Kailangan, baka akala po ng mga tao porque this is serum-based, yung dugo po, no? Kumukuha tayo ng dugo ay hindi na kailangan mag-PPE. Kailangan pa rin pong mag-wear ng appropriate PPE ang gagawa nito dahil yung possibility pa rin ng transmission. Kailangan i-follow natin yung protocol na ibinigay ng DOH kapag gagamit tayo nito. Next please. So ito lang mapakita namin kung ano po ang ginagawa natin to scale up our testing capacity. Unang-una, in-optimize po natin ang kapasidad ng ating existing subnational laboratories. Meron na po tayong 20 ngayon sa buong bansa na amin lang pong dinadagdagan ng mga makina, dinadagdagan ng mga tao, dinadagdagan ng mga supplies para mapataasan pa ang kanilang kapasidad. Dati po, iisa lang po ang ating laboratorio, yung RITM. Pero ngayon, 20 na po sila. Dati po, ang ating output lang ay 300 per day. Pero ngayon, ang ating output po ay umaabot na po sa 5,000 per day. So ito po yung mga ginagawa natin para ma-maximize natin ang capacity ng ating independent subnational laboratories. Dati, they only work 8 hours. Ngayon po, 16 to 24 hours na ang kanilang ginagawa. Number 2, gusto pa rin natin makapag-certify at lisensya ng mga ibang subnational towards independent testing, lalong-lalo na dun sa mga lugar na alam nating kailangan talaga. Tinutulungan po natin sila at meron po tayo sa ngayon na about 47 na inaantay pa ho natin na ma-sertipika at malisensya para mas dumami pa ang ating mga laboratorio. Pangatlo, nagpapatayo po tayo ngayon ng mga malalaking testing centers, pop-up labs in strategic areas around the country. Meron na po tayong bubuksan about 1st or 2nd week of May. Yun pong ating sa Region 3, JB Lingad Hospital, kung saan nagkaroon tayo ng project partnership with ADB at magkakaroon tayo ng malaking laboratorio dyan na magbibigay sa atin ng 3,000 tests per day. Meron na po tayong pakikipag-usap sa private sector ngayon, yung pong tinatawag natin na pop-up or modular labs na ilalagay po sa iba't ibang bahagi ng bansa para na magkaroon tayo ng access sa testing. At pang-apat, yun pong ating ibang testing approaches katulad ng gene expert machines po natin ngayon. Sa kasalukuyan, meron po tayong 19 na facilities which are already ready to do testing for gene expert. Ito pong gene expert natin, mabilis po ang test nito, in 45 minutes na gagawa po ang proseso. Ngunit ang ating limitasyon dito ay yung supply po ng ating cartridges na tinatawag para makapag-test. Alam po natin ngayon, meron tayong mga international shortages. Tinitignan pa ho natin kung paano natin mabibigyan solusyon ito. Pero pag tinignan ho natin itong 4 na strategies na ito po yung makakapagbigay sa atin ng ating goal na 30,000 tests by the end of May. Next, please. So ito po yung for isolation and quarantine. No? So katulad ng ating slides kanina, exposure and with symptoms. So all those with exposure and symptoms, kailangan i-isolate. Pag sinabi nating isolation, ito po yung mga facilities natin na kailangan ng medical personnel. Now for those without symptoms but with exposure, they have to be quarantined. So ito po ay pwedeng non-medical personnel o yung mga barangay health emergency response teams natin katulad sa mga ligtas COVID centers natin ang gagamitin. Next please. So our case management principles. Unang-una, ang first line of defense po natin, tayo, ating mga individuals, ang ating mga kabahayan, mga pamilya. So gawin pa rin natin yung ating mga routine disinfection, hand hygiene, cough etiquette, and social distancing. Second line of defense would be our primary care. Ito po yung ating mga BHWs, mga barangay health emergency response teams, our GPs, no, yung mga general practitioners. Pero ang ating nire-recommenda ngayon, telemedicine, para wala ng face-to-face contact na babawasan ang posibilidad na magkaroon ng transmission. Third line of defense is our facilities. Ito po yung ating mga ospital, ang ating mga temporary treatment and monitoring facilities, and our step-down care facilities. And of course, dapat may referral network. Alam niyo pong lahat yung healthcare provider network na nakasaad sa UHC. Sana po magawa natin ito, organized by province and cities, linked to the different facilities and subnational laboratories. And please do not forget to maintain the 2 pathways, the COVID and the non-COVID. Next, please. So, ito lang po yung iba't ibang klase natin ng mga temporary treatment and monitoring facilities. Meron po tayo sa mga local governments natin ng ating ligtas COVID-19 centers. Ito po ay para sa ating mga person under monitoring, mga suspect cases, mga probable at pwede ring confirmed kung mild, no? And then for megaligtas, yung mga big facilities natin sa National Capital Region, ito po ay para sa suspect, probable and confirmed. And of course, our step-down facilities, ito po yung mga district hospitals natin or level 1 hospital. So, yun pong para sa mga wala pang mga test, yung mga PUM, suspect and probable, kailangan po hindi po natin sila pinagsasama-sama. Kailangan may individual rooms with individual toilets. Ngayon, kung hindi naman po kaya ng ganitong arrangement, kailangan lang po meron tayong strict measures, no? Kailangan ang mga kama sa isang lugar 3 feet away from each other or 1 meter apart. Kailangan scheduled ang pagpupunta sa banyo ng mga pasyente at kailangan madidisinfect ang mga ginagamit na toilet or shower facilities pagkatapos gamitin ng mga pasyente. And of course, kapag positibo na, pwede na tayo mag-cohort. Next, please. So for recoveries po, kailangan lang ho natin maintindihan, no, na yung pong mga nakaka-recover na meron pang konting simptomas, maaari na po natin silang ilipat sa ating mga temporary treatment and monitoring facilities or step-down facilities kapag binigyan na po ng clearance ng kanilang doktor. Kapag yung tinatawag nating clinically recovered na wala na ho siyang kahit na anong simptomas mula po nung naumpisahan siyang magkaroon ng sakit, maaari na po siyang ilabas sa ospital kahit po wala siyang test na gagamitin, pero kailangan mag 14 days pa rin ho siya ng quarantine, maari sa TTMF, maaring sa step-down facility o sa bahay nila, basta may clearance ng doktor. Ang sinasabi nating fully recovered, yung mga tao na nakapagkumpleto na ng another 14-day quarantine natin at RT-PCR negative na po. And then of course, reintegration sa community, maaring dapat bigyan ng quarantine medical officer o kaya ng city health officer, municipal health office ng certificate ang mga taong nakakatapos na ng ating quarantine or nakakatapos na at nakaka-recover na po. Next please. So this is my last slide. It's quite busy and it's quite small. Pero ito po lang yung ating mga roles na pwede nating gawin, no? Per level of governance. So pag sa barangay po, ang ating mga point persons would be of course our municipal health officers and city health officers, and we have our active barangay health emergency response teams. So ito po nakukuha natin yung mga close contacts, mga persons under monitoring and suspects. And ang kailangan contact tracing, and then we need to facilitate their testing po kinakailangan, and we can use our temporary treatment and monitoring facilities. Kapag dating naman po sa munisipyo or sa city, ito naman po ang maaring isagawa po nila, no? For the provincial and the LGU, they have the infirmaries or the level 1 facilities. Also, they have levels 2 and level 3 hospitals. So ito naman po ang maaring mga gagawin po na kailangan, no, for detection and disease surveillance and interventions. And of course, regional and the national. So, ayan lang po ay parang naging summary ng lahat ng sinabi ko kanina. And I think this is the last of my slide. Maraming salamat po.
Maraming salamat, Yusek Vergere, for that very comprehensive information po yung binigay niyo sa ating mga televiewers, no? So right now, we have 269 at saka live din po tayo via Facebook. So there are 3 key points that I'd like to raise. First, yung guiding principles on the new normal po. This is very important because we are providing an enabling environment for a people-centered and resilient community. So we have to take into consideration the framework on the whole of society or whole of government approach para seamless po ang collaboration natin. Yung second point po na raise ni Yusek Vergere is about telemedicine. So this is an answer to our problem right now, no? And we are doing some initiatives on e-health solutions. So later on, magkakaroon po tayo ng training programs dyan para mas accessible ang ating telemedicine. And the third point is the national and local relationship. No? Maganda, nakikita natin because the national government is really pushing for the policies, providing local government mechanisms and how to operate in our health systems, no, para ma-manage natin yung crisis today. Okay, so maraming salamat ulit, Yusek. Later on po may mga questions po tayo sa ating participants. Now let's proceed to our second resource person mula sa local government of Marikina City, our health officer, Dr. Olga Vertusio. She is representing Mayor Edwin Olivares. Ma'am, are you there? We have Dr. Olga from Marikina City.
Good morning. Yes.
Yes, ma'am. Good morning po.
Good morning. Good morning to everyone. Okay. So, can you see my slides? Hello, good morning.
Yes, ma'am. It's about to share. Kindly
Yes.
press the share screen. Thank you.
Yes. Okay, so I'm going to start now. Good morning to each and everyone. Of course, ating Yusek Jonathan Malaya. Good morning, sir. So from the city of Parañaque, we would like to share with you what we have done in terms of expanded community-based COVID-19 testing. Okay, so to share with you, I will be discussing the background, the timeline, and the implementation as one of our best practices here and our statistics today.
Yes.
Okay, so it was way back around the last week of March, no, and first 2 weeks of April 2020, when we noticed that there's a high number of PUMs and PUIs, no, in terms of a number. Our confirmed cases have risen to almost quadrupled, no, in just a matter of 7 days, with 6 deaths. And the receipt of a lot of donation of rapid antibody test kits, around 16,000 rapid test kits arrived in the city from various donors. And of course, in our desire for the alignment, no, with our strategy locally to align with the national strategy of detect, isolate, and treat in terms of the operational methodology. So to detect the carriers as shared by our ASEC Verhere, to detect the carriers and potential carriers, to isolate the carriers and potential carriers, to treat the carriers and potential carriers, and finally to return them to normal, which we were able to listen earlier. So with that, if I may share with you how it all started in the city, it was in March 16, no, when the implementation of community quarantine was announced, no, by our president, and the city of government of Parañaque has established already an incident command system. It was on the third week of March when the increasing cases was a little bit alarming for us already, and with the receipt of donated test kits, it opted us to actually try to strategize already on how to make use of these donated kits. On the fourth week of March, there was an increased availability of UTM and the conduct of our OPS and NPS by the City Epidemiological Surveillance Unit under the City Health Office was enhanced, no, with the arrival of a new set of UTNs and at the local level. On the first week of April, we needed to recalibrate our plans at the local level in order to align it to the detect, isolate, treat operational methodology of the task force COVID, no, at the national level. And it was on the second week of April when the Department of Health actually released, no, the testing algorithm and guidelines and our eventual local adaptation in Parañaque City. So this prompted us already with the guidelines in hand. We opted already, no, to set up our testing and isolation sites in the city of Parañaque. So on the third week of April up to the present, we have already started our expanded community-based COVID-19. And in fact, we have enhanced this with a partnership with the Philippine Red Cross. So with our recalibration and with the provision of the different guidelines by our Department of Health, it strengthened our conviction to start doing a rapid test, primarily to be able to help us, no, in the isolation as well and classification of the different groupings, no, in the locality, in order to make it easier for us to segregate, no, and to take action in terms of quarantine and isolation. So early preparation was done, and our mayor, the mayor Edwin Olivares, was very fast, no, in tasking our engineering department to come up with our locally made rapid testing facility. No, it's more of cubicles actually, which we have now in the different testing sites. And of course, with the help of partners of the local barangay, they received some donations as well for swabbing. But we also have our own testing, our swabbing cubicles, no, which was done by the city. And when we were ready, we started actually the implementation in April 20, no, 2020, where we have identified OSPAR 1. This is Hospital ng Parañaque 1, Hospital ng Parañaque 2, our Parañaque National High School, as well as the testing site and various sites where people can access, no, and the immediate scheduling of the different groups for immediate rapid testing and classification. And of course, this was simultaneous the different contacts at the local level and those identified with exposure and with the symptoms, signs and symptoms, no, who are in their homes were visited, no, and our CESO team actually conducted a clustered swabbing also at the barangay level. So with that, we started with the antibody testing and the swab PCR testing complementation. And with the basing it on the guidelines provided by our Department of Health, we have the presumptive COVID-19 case if you get an IgM positive and an IgG negative. So with this, we have to isolate in designated quarantine facility and do our NPS and OPS. And if the RT-PCR is negative or not, or whether it's not available, we have to repeat the test, no, at the end of the 14 days and follow the usual algorithm based on the result. Now, if the RT-PCR is positive, we have to continue the isolation and follow the guidelines in the RT-PCR, no, using, of course, with the use of our. Now, in terms of presumptive COVID case, which means that we have an IgM that is positive, an IgG positive, or an IgM negative, and then IgG positive, we isolate, no, and do an NPS OPS, and we wait for a negative result for RT-PCR prior to their clearance. And then if the patient is not a COVID case, which means that this is an IgM negative and an IgG negative, if all symptomatics, we isolate and do an NPS OPS. If it's asymptomatic, if it's a non-health worker, we don't need to isolate the patient, but instead we advise the NPS OPS if symptoms develop. Now, if it's asymptomatic, the healthcare worker, we isolate and do the NPS OPS, no, and of course advise the healthcare worker to return to work, no, if they continue to be asymptomatic for 7 days. So what was the good thing is that during the actual rapid testing, we have a post-test, no, counseling, which is done by our medical officer in charge, no, of our laboratory rapid testing, which means that if they get an IgM positive, they are being counseled through a telephone. Okay, so we call that with the positive patient will receive a call from our medical officer to be advised and to be given the result and to be counseled as to what to do. Then the patient is given the option whether to be isolated in our facility or in their facility, in their homes, if he has his own room, toilet, and bed. All right. So also in the same facility, we have a looped-in audio recording, information education uh, material, no, which during the waiting period. We have a waiting period, whether it's a post test, which is 15 minutes after the rapid test, or while the rest are waiting for their own test. No, so during that waiting period, they listen to a video also done by our facility, no, by our rapid testing medical officer, such that they listen to the do's and don'ts while they are in the screening area. They are being informed what IgM positive, IgG positive, or IgM negative and IgG negative are. And this has to be explained to them, no, during the loop audio recording. So they would better understand what they will go through, no, and they will be able to learn more about the importance of why they are there and what they should be doing afterwards if they get a negative result. Now, all individuals for testing are scheduled, no, in the City Health Office laboratory. This is to make sure that the attainment of quota is without crowding. So we strictly observe social distancing during the screening period. Okay, so when they reach the gate of the school, PNHS is one of our big schools in Parañaque City. So in the gate alone, they are already tested whether they have fever or not. So scanning is done, and immediately the CIF form is provided to them and given to them for fill up in one area, no, in one side of the school. And then after filling this up, they proceed now to the actual screening area. And in the screening area, all the CIFs are collected, no, and we make sure that the CIFs are properly filled up, especially their telephone numbers and addresses. Also, we have identified fixed sites, no, for testing sites. The primary purpose of putting fixed sites is this is for our frontliners primarily, which some are mildly asymptomatic and some are asymptomatic, but we have to make sure being exposed as well to a lot of people, no, in the line of their work. So we have a specific site which is in Parañaque National High School. Then we have OSPAR 1 and OSPAR 2. We opted to maintain it in these three areas because in one of the sites that we have identified earlier, we feel it would be a little bit difficult, no, for the people to go there because of a lack of space for where we can set up a waiting area. Okay, so the other sites, of course, is our clustered swabbing sites, no, this is being done at the barangay level and being coordinated by our CESU. And we also have our PCC as a temporary confirmed COVID isolation facility, whereupon when they get to be about to be discharged, we do actually a rapid test for them. Okay, and once they turn negative, we continue to advise them already to be transferred. And if they are asymptomatic and continue to be and already negative in the rapid test, they are being transferred now to our step-down facility, or otherwise, they can opt to go home already for for those who are IgG positive. So currently, we have this inventory just for your information. No? So we have a lot. Our rapid tests are consumed at this point, and our mayor actually has tasked your city health office to be getting a new set already, since we have consumed those FDA-approved test kits that we have on hand. But this is now complemented with our Red Cross UTMs that has arrived. And we still have a stock on hand, but we continue to do the testing to all our probable cases. So different groups are doing the UTM and the RT-PCR, no, at the same time. For our rapid test, just to share with you that out of the total FDA approved test kits, we have already done 2,283. No, this is a test as of May 1, 2020. OSPAR 1 had obtained 10 IgM positive, OSPAR 2-1, PNHS 6. So for IgM positive, we had a total of 17 out of those tested. For IgG positive, 67 out of those tested. Both IgM and IgG positive. And this is, with this test, we have lined them up actually for RT-PCR, 36 together with IgM positive, no? Either IgM or IgG positive. We have 4 of that, and if they continue to be asymptomatic, they are due for observation. No antibodies detected or negative for the rapid test is 2,159. So we have done a total test of 2,283. In terms of stats and numbers, our if you will notice, it was actually in April 26 that we started our first batch, no, sent to PRC already, and we received only the result to date, no, and all the first batch that we have sent them, all probable cases have turned out to be negative. Now, for the simultaneous mass testing report or expanded testing report, I think this is for day 121 of COVID. Our cumulative summary report is have totaled to 3,503 to date. So with that, marami pong salamat. That's how we are doing now our rapid simultaneous expanded rapid testing, a combination and a complementation of rapid testing and RT-PCR.
Maraming salamat, Dr. Olga Vertusio. I stand corrected earlier. Dr. Olga is from Parañaque City Government po. So there are a few points raised by Dr. Olga. First, she shared the development and status of the expanded COVID-19 testing and also how Parañaque coped with the challenges of COVID-19. So for Parañaque, talagang early preparation is the key. No? And they were able to establish early on the community quarantine incident command system. And also they were able to locally produce rapid testing facilities with the help of their stakeholders in the community. So maraming salamat, Ma'am, Dr. Olga. Now, our third resource person is from the City Government of Marikina. We would like to welcome Dr. Alberto P. Herrera, representing the mayor of Marikina City. Doc?
Okay, magandang umaga po sa lahat. Sa ngalan po ng ating pamahalang lungsod ng Marikina Mayor na si Mayor Marcy Teodoro, nais ko pong i-share sa inyo ang ating pong mga napagdaanan and experience sa pagtatayo po ng ating Marikina COVID Laboratory. So, history lang po, nung time na dumadami po yung ating mga kaso dito sa lungsod ng Marikina, nung bandang March 16 ay nagplano na po ang City Government ng Marikina na magtayo ng COVID Laboratory. At nung tayo po ay nagtayo na ganito, ito po ay ating pina-inspect sa Department of Health at nalaman po natin ay hindi tayo napayagan dahil sa ang COVID Laboratory po pala ay kailangan nating stand-alone facility. Kailangan po ay walang masyadong foot traffic at kailangan daw po siya ay naka-separate sa ating main building ng City Health Office. Okay? So maliban po doon ay napaka-importante rin po ng trainings. Hindi po tayo pwedeng magpatakbo ng isang COVID laboratory nang wala pong karampatang training on biosafety and biosecurity. At yun po ang ating ginawa dito sa lungsod ng Marikina. So nung time po na hindi tayo napayagan ng Department of Health na magtayo ng COVID laboratory dun sa City Health Office Building, agad po tayong naghanap ng panibagong lugar at ito nga po ay nakita natin sa Bayan-Bayanan, Concepcion 1. At ito po ay ating sinagawa sa loob lamang po ng 14 days ay naitayo natin itong laboratory nito. Ito pong ating standalone facility ay dati na pong may structure at ito po ay ating ni-renovate nang naaayon sa standard ng Department of Health, no? Sa standard ng guidelines na set by the Department of Health. Okay? At ito po ay natapos natin at pati po ang mga trainings natin sa ating mga staff ay natapos din po natin. At nakapag undergo rin po tayo ng proficiency testing sa RITM. Naipasa po natin yung proficiency test nito. At ngayon po ay, kahapon po ay holiday kahapon, bagamat hinabol din po ng Department of Health na maibigay na rin yung license to operate ng Marikina COVID laboratory para po tayo ay makapag-operate na isa sa mga molecular laboratory ng bansa. Kaya sa Lunes po ay magiging puspusan na po ang ating pagtitest dito sa ating Marikina COVID laboratory or Marikina Molecular Diagnostic Laboratory. So nais po natin na na itong mga laboratory natin na ito ay magamit natin para dun sa ating subgroup A and subgroup B na naipaliwanag kanina ni Dr. Yusek Berhere. At sila po yung mga priority natin na pagka nalaman natin na sila po ay may karamdaman, nag-positive dito, ay magkakaroon po sila ng immediate isolation or dun sa ginagawa rin natin ng mga step down na facility na kasalukuyan po natin ginagawa rin. So yan po. At sa ngayon po ay tuloy-tuloy po yung ating mga ginagawa rin ng iba pang activities sa lungsod. Yun kung ating Marikina Hotel ay ginawa rin nating isolation facility for yung ating mga patient na with history of travel or with history of exposure ay doon po natin dinalagay. For 14 days po ay naka-quarantine sila sa Marikina Hotel. At maliban po doon, meron din pong para ma-minimize din yung ating exposure, nagkaroon din po tayo ng mga telehealth projects sa lungsod ng Marikina. Okay? So yung po yung ginagawa natin at sa Lunes po ay magkakaroon tayo ng maraming testing para dito sa lungsod ng Marikina.
Maraming salamat, Dr. Herrera. So key points raised by Dr. Herrera from Marikina City, yung COVID laboratory. Agad-agad nag-respond sila, although hindi siya recognized by DOH, but within 14 days, they were able to make one. And another thing is yung conversion of Marikina Hotel into an isolation facilities. So mabilis po ang pag-respond. And moving forward, magkakaroon din ng telehealth program si Marikina. Okay, so ngayon, madami pong questions nakalagay sa ating chat box, but I'd like to recognize first Mayor Lacambini Net Reluya from the municipality of San Fernando, Cebu. Ma'am, very briefly po, you can pose your question right now with our resource persons. Mayor Net.
Hello, Mayor.
Yes, Mayor Net, please go ahead.
I'd like to ask, limited kasi ang presentation sa graduation of the PUMs. After that, what are the interventions being undertaken by the local government units?
Okay, so I think Yusek Vergere can answer first, and then see Dr. Herrera and see Dr. Olga.
Yes, ma'am. The question would be what we do after the PUMs finish their 14 days quarantine. Is that right?
Yes, Doc.
Yes,
That is
ma'am. Yes, magandang umaga po, Mayor. Ang atin po mga person under monitoring, ito po yung mga taong walang simptomas pero na-expose sila or are direct contacts of those positive cases. Pag nakatapos na po sila ng 14 na araw ng quarantine, maaari na po silang bumalik sa kanilang bahay kung sila ay nasa temporary treatment or monitoring facilities. O kung nasa bahay sila, maaari lang po magpalakas at continuously monitor po rin natin sila sa kanilang mga tahanan. Pero after 14 days naman po at wala silang na-develop kasi na simptomas while being quarantined, wala na ho tayong dapat paalala dyan. No? Sila po ay cleared na kapag kaganyan.
Thank you, Yusek Vergere. Dr. Olga?
Opo. Ma'am, good morning po, Mayor. Actually, in the local government, it's the same, no? What has been shared, by our Yusek Vergere is exactly what we are doing, no? And until now, we continue to monitor the PUMs in the area, and we also provide the certification, no, at the end of the 14 days. But we make sure that these PUMs really are being monitored by our BHERTs, because the only people who can certify at the barangay level will be the BHERTs and the medical officer in charge of that particular barangay. So once they are able to certify that these people have been monitored, they will attach their monitoring form and their certification that indeed this particular patient underwent monitoring, no, in their barangay, and this will be submitted to my office for the issuance of the official certification, no, at the city level. But of course, we have to also validate, and this is being validated by our medical officer at the local level. Yun lang po, ma'am. Now, once these PUMs develop signs and symptoms, then they will be included in our further workup, no? They can be included in our suspect for inclusion, and we will see, and we will be managing them at the barangay level. The medical officers will manage, provide supportive management, no, at that level.
Doc, may I ask some question again?
Yes, yes, ma'am.
Ulit.
Yes, Mayor.
We are also doing that, Mayor. Ang sa akin is yung integration in the community aspect. What are the do's and don'ts upon integration or right after integration? Ano ang pwedeng gawin ng isang PUM na nakatapos na sa kanyang 14 days quarantine?
Maybe.
So I respond, ma'am?
Yes, ma'am. Yes.
Doon ako sa integration aspect.
Yes, ma'am. Can I respond?
Yes,
Yes.
Yes, Mayor, alam nyo, napaka-importante po ng edukasyon at impormasyon sa ating communities, no? Because ang dami po natin naririnig na kapag ang isang tao ay na-classify pa nga lang po na PUM, hindi pa nga siya positibo, ay ang talagang diskriminasyon at saka yung harassment na nangyayari ay napakadami, no, na nare-report sa amin. So ang atin pong unang-unang strategy dyan, we need to educate and inform our community of our processes para alam po nila na itong taong to, they underwent 14 days quarantine. Dun sa 14 days na quarantine niya, wala siyang naipakitang kahit na anong simptomas at natapos niya at may certificate siya. And also, the second one would still be monitoring. Hindi porke natapos na siya ng 14 days, we still need, hindi kailangan naka-quarantine pa, but we need to check on them every now and then. if ever they would still be developing symptoms after those 14 days of quarantine. Pero napaka-importante po talaga, Mayor, ang impormasyon at saka edukasyon for the community para mawala po yung ganitong stigma sa ating mga pasyente.
Yes, yes.
Alright. Maraming
Thank you,
salamat, Mayor and Yusek. Dr. Herrera, would you like to say something on the question of Mayor Reluya?
Okay. So sa Marikina po, yung mga PUMs po natin may dalawang kategorya. So yung ating PUMs natin ay nilalagay natin sa Marikina Hotel. Ito po yung may history of exposure at saka yung meron ding mga history of travels. At sila po ay nag-undergo rin ng 14 days na quarantine at binibigyan po natin sila ng certification pag nakumpleto na po nila. Yun lahat po ng mga pangangailangan ng tao sa Marikina Hotel ay sinasagot po ng city government. Mga pagkain nila at iba pang needs ng naka-quarantine doon. At meron din po tayo nagko-quarantine din sa bahay. Ito po yung strict home quarantine. At ito po naman ay para masabi nating strict home quarantine ay binabantayan po ng ating mga kapulisan, ng mga barangay tanod. At kung meron naman pong pangangailangan din na pagkain o kung ano pa pong pangangailangan itong mga naka-strict home quarantine natin, ay binibigyan din po ng ayuda ng city government para doon. At sila po, pag nakatapos din po ng 14 days, ay binibigyan po natin ng certificate na sila po ay nakakumpleto na ng quarantine period nila. At ganun pa man, ang abiso pa rin natin ay patuloy pa rin nilang i-monitor yung sarili nila. Just in case na may lumalabas pong mga iba pang mga sintomas, ay pagbigay alam kagad sa amin o sumangguni sa ating mga health center.
Okay. Maraming salamat po. We have another question from Dr. Michael Campued, is the founding board of the Philippine Society of Public Health Physicians. Doc Mike?
Hello po. Hello po, Yusek Verhere, kay Mula, at kay Doc Albert po. Salamat po sa presentation. It was very clear and very well appreciated. Especially dun kay Ma'am Olga. Thanks for giving us such parang detailed approach on how to make use or maximize rapid antibody testing. I was reading yung ilang reaction sa group chat and yun nga ito po siguro ipaparating ko po kay Yusek Verhere kasi sa kasalukuyan ang mga LGUs ay kinakabahan gamitin ang rapid antibody test. The rapid antibody tests are already here and the narrative that is being produced under most authorities and also DOH is fear na gamitin yung RDTs instead of actually making it known that this has a use in public health. So, paglilinaw lang po, no? Kasi stepwise po ang pag-approach natin kapag limitado ang ating RT-PCR at saka limitado ang ating testing capability. Hindi natin kayang RT-PCR ang lahat ng tao at hindi rin pwede na panay symptomatic lang ang tingin natin sa mga pasyente kung paano natin i-isolate o hindi. Kapag sa symptomatic, tumataas ang ating kakayanan para na-identify kung sino yung mas dapat tutukan kapag nag-apply tayo ng isang level of test, which is a rapid antibody test, which is a qualitative thing. So it increases yung predictive value ng ating testing. Tapos kapag na-identify din natin through rapid antibody testing kung sino dapat na i-prioritize for the PCR, mas nagagamit natin ang RT-PCR very well. So parang inilalaikan ko po yan sa casting fishnet. Kung hindi naman pare-pareho ang lawak ng butas ng net pero nakakahuli rin isda, gamitin natin sa lalong malawak hanggat hindi pa lahat ng area may RT-PCR laboratory or SNL subnational laboratory. So sa akin po, is DOH now creating this narrative that they encourage LGUs to use the rapid antibody test instead of just warning them about it. Thank you.
Yes, Yusek?
Yes, thank you for that question. No, alam nyo, kailangan po klaro tayo, no, doon sa mga sinasabi namin. Hindi po namin sinabi na walang puang ang ating rapid antibody test sa mga ginagawa natin dito sa ating laban kontra COVID. Ang sinasabi lang ho namin, kailangan klaro po tayo. Kailangan naiintindihan natin kung ano ang dapat na gamit nitong rapid antibody test. Sinabi po natin, hindi po ito stand-alone na test. So kapag gumamit po kayo nito, kailangan nyo pa rin ng RT-PCR. Hindi rin po pwede na gamitin nyo po ito para makapag-diagnose kayo kung sino ang may COVID at hindi. hindi porke kulang ang ating mga resources ay pupunta na po tayo at gagamit ng isang bagay na wala tayong kasiguruhan. Kailangan ho nating isipin ang ibinibigay na benepisyo ng isang test para sa atin. So ito po, tinanggap ng Department of Health, nagbigay po tayo ng protocol kung saan pwede natin siyang gamitin. Magbibigay lang po ako ng halimbawa. Kung sakali po na ginagamit natin to dahil wala nga tayong RT-PCR dyan sa mga lugar na yan at sinasabi natin na nakakapagpabilis at nakakatulong sa mga local governments para masabi kung sino ang dapat i-isolate at hindi. Paano po yung mga lumalabas na false negative dyan sa mga ginagawa natin? Anong ginagawa po natin sa kanila? Pinapauwi po ba natin sila? Ay hindi pa buho ba na mas kakalat ang infection kapag kaganon? Kaya ang lagi ho namin pinapaalala, wala hong pumipigil, gagamitin natin yan because it really is a supplement to our response. But it has to be used in a rational manner and according to the guidelines of DOH kung paano po natin siya inakma doon sa polisiya para magamit sa expanded testing. Yun lang po yung sa amin. It's not a standalone test. You cannot use that to diagnose who are positive and who are negative. And you should always be aware of the limitations of that test.
Maraming salamat, Yusek Vergere. Before we proceed to Dr. Alex and Dr. Mendoza further questions, meron tayong question sa chat box for Dr. Olga. Ang tanong po ay, while the national government proposes a national plan, which usually comes in a generic standardized guidelines, LGUs can respond in accordance to the needs presented at the grassroots levels. My question is that, what are your challenges in adopting these national guidelines? And if any way, what are the innovations you've engineered to ensure that testing and treating COVID-19 succinctly to the peculiarities of your grassroots communities? Mayor, Dr. Olga. Please, ma'am.
Thank you very much, ma'am. Thank you very much po sa question. With the national government cascading down to us, the detect, isolate, and treat strategy, operational strategy, that we have to implement. Definitely, we cannot adapt, step by step with what they have cited, and mentioned. But at the local level, we need to be more than innovative, truly to adapt to our local situation. And right now, in order to do that, and in order to facilitate our action, for us, it's very important that the more people we test, the better for our population, because it will be faster in terms of segregating and putting to quarantine these people. The rapid testing and the complementation of the PCR is helping us do that. But more than that, we needed to in the earlier stage actually of this incident in our country, we already identified the need for us to consider a possible isolation areas as well. If in any event there will already be a community transmission. And that's exactly what happened. Because in our city, noticeably, more people in the gated subdivisions are affected. However, they have their own rooms. They have their own houses and their own rooms for isolation. What about the people in the community who are deprived of this? So we needed to put up isolation areas as well, isolation sites. First, we were able to set up already isolation site. First, for our confirmed cases, where we had a really difficult time referring to most of the private hospitals around the area, except for some hospitals outside. And it was so sad to see these patients suffer so much and eventually die because of lack of facility to really cater for them. So our Parañaque City College identified by our Mayor Edwin Olivares to be our initial isolation site for confirmed cases. Then we have identified also the Parañaque National High School Isolation Site. Have identified a step-down facility as well, which is our San Antonio High School. No, so we have the three steps already. Aside from this is a multi-agency working together, no, to have all this in place and functioning. And right now we are very functional. We have 14 cases confirmed asymptomatic and mild in our confirmed case isolation site. For those with the symptoms and with the capability for us to isolate, we have specialists as well in our OSPAR 2, no, which is identified as another isolation site for confirmed and for PUIs and PUMs who are asymptomatics, no, and they are being admitted there. And then we have also because we are just starting, we needed to have an initial screening of all this, which is being done as well by the clean cases goes to the OSPAR 1. Then we have set up our emergency response team, a division, our is acting as the team, as the team that will ferry the transport of cases, no? Should they be transported from the house to the isolation facilities. And together with this, our DRRMO team as well. And then we have the fire. Right now, we already have, I think our fire have the emergency transport vehicle, which we can also use, no, for transporting patients that are not so critical, no, and severe. Then aside from that, we have the local level. We have a systematic response to the social amelioration provision, no, at the local level. So I think in terms of economics, in terms of health provision, and in terms of response, we are fully functional. All our health centers are open to continuously provide the usual services, no, that are needed. Critical of which is the provision of our TB meds, our vaccines we make sure that our patients don't miss on their vaccines, and the challenge that we have encountered so far, one of the challenges that saddens me actually is the closure of some of our health centers, because we have to shut them down because of the exposure of some of our health workers already, who are now undergoing quarantine themselves. So I have 4 of my health centers which are shut down, but our medical officers are the ones continuously monitoring, no, the respective personnel. And from time to time, if I have the time, I make sure that I get to say a hello or hi to them through telephone. And our mayor also provided an isolation area for the health workers, and we have this in Nichols Hotel. This is the isolation area now for our health workers who have been exposed, and they are being provided with 3 meals a day. They are provided with their appropriate communication. We make sure that communication is being open, no, to them as well. And another challenge would be, I mentioned first challenge. The another challenge is that even as we report to duty daily, 24/7, no, so we have divided our teams into 2 teams, so that we make sure that if one of them has been exposed, we make sure that another set of manpower is still available to be deployed. Okay, so two sets of team would go to work 4 days interval, And we make sure that no day is closed without a personnel in the City Health Office. And we also have formed our information unit, the Health Education Promotion, we call it the CHIS, the COVID Health Information System, where this is composed of dentists and nutritionists, because they are more of not medical people, but they can be used as information officers, no? So they receive calls, queries, and they facilitate referral from the community to the medical officers to facilitate the referral now to the different isolation sites, should this be needing immediate transfer from the house to the isolation sites. And
Maraming
then we have
salamat,
established...
Olga. Medyo sorry po, ma'am. Ikakat na lang kita. Maybe you can
Opo.
reply dun
Yun
sa
lang
chat
po, ma'am.
natin. Oo. We have so many questions kasi na naka-feed ngayon, but you can answer the questions dun sa chat box po natin. I'd like to ask Dr. Herrera po, may tanong dito. Will the city of Marikina open to process tests from other neighboring cities to complement national laboratories?
Sa ngayon po, bali, dahil sa Lunes pa nga po kami magpo-full blast ng operation, unahin po namin yung aming mga constituent dito sa Marikina. No? Marami po tayong mga subgroup A and B na kailangan pa rin nating matutukan at ma-test kung sila po ay positive or negative at magawan kaagad ng karampatang solusyon. Pero open po ito na nabanggit na po ni Mayor sa aming neighboring cities and municipality na open naman po itong laboratory namin dun sa mga nabanggit kong city and municipality.
Maraming salamat, Dr. Herrera. For Yusek Vergere, you mentioned in your slides earlier that during this COVID-19 crisis, that human dignity will always prevail. Ang tanong po is, how can we ensure that this is being prioritized and respected when calls for improvement in the system is constantly being branded as anti-government or leftist-inspired and sometimes threatened or dealt with violence po?
Yes, I don't quite understand the question, but I just like to focus on, we are focusing on human dignity, and dun po sa mga ginagawa natin, lagi po natin kino-consider yung mga karapatan ng mga tao, lalong-lalo na dito sa contact tracing na sinasabi natin. Nagkaroon po tayo ng pakikipag-usap sa DILG, sa National Privacy Commission, at sa iba't ibang ahensya, no? Dahil nga po itong mga nakikita natin na mga naipopost na mga personal details ng ating mga pasyente and all. Because we consider human dignity, we have drafted this data sharing agreement and implementation with DSA, whereby ang pinayagan lang po natin ay yung mga importante lang talaga na mga detalye na ibibigay lang sa local officials at hindi kailangang i-broadcast sa buong komunidad. So I think that's just one example of us giving much focus on the human dignity and the rights of a person when it comes to this response.
Yes. Another question, Yusek. As we aspire for a holistic approach in fighting COVID-19, can our health system be able to capacitate by putting testing centers in rural health centers to augment the increasing demand to test PUIs and PUMs?
Alam niyo po, bukas ang kagawaran ng kalusugan sa kahit na sino na gusto makapagbukas ng laboratorio para po tayo ay magkaroon nitong malawakang pagtetest. Kasama niyo po kami dun sa ating goal na test, test, and test. Kaya lang po, sana alam po ng ating mga kababayan, napaka-highly technical ng pagbubuo ng laboratorio na ito. We are dealing with the live virus. So ang atin pong minimum requirement para magkaroon ng ganitong laboratorio is the biosafety level 2 na laboratorio. Kaya yun po ating mga, wag kayong mag-alala dahil namapa na ho natin ang ating mga area sa buong bansa para malaman namin kung saan kami dapat unang maglagay ng mga laboratorio aside from NCR and Luzon. At gagawin na ho natin start Monday, nakapag-usap na tayo with the National Task Force. Meron na ho tayo napiling mga pwesto na tutulungan na natin ang mga laboratorio dyan para magkaroon tayo in the soonest possible time.
Okay, maraming salamat, Yusek. 2 more questions. May 5 minutes po tayo. From Dr. Maria Fe Mendoza, ma'am, do you have one question for our piece? Okay, parang hindi sumasagot ngayon si Dr. Fe Mendoza. Oh, ma'am, there you go.
Okay, good morning everyone. Thank you, Yusek Herrera, and thank you to our health officers, Dr. Olga and Dr. Herrera. I have questions for the 3 resource persons. For Yusek Herrera, very good po yung ating whole of system, whole of government, whole of society framework, and yung recognition and upholding of human dignity. Kaya lang po dun sa whole of system government, para pong dichotomize po yung arrangement. Kasi po yung national government ang naggagawa ng policies, policy directions, tapos ang local officials po, local government po ang nag-i-implement. Kung hindi po ba pwede, kasi in order to prevent yung mga challenges, particularly with the first round of implementation of the ECQ, na medyo even in the policy formulation, kasama na po yung local government para hindi po nagkakaroon ng parang problems with translation. Yung second question ko po sa inyo, how prepared is our health system to fight COVID? You mentioned that we have increased our capacity for testing. We have parang activate our local health emergency response teams. There is a circular for an interagency task force at the local level. But in general, ano pa po ba ang kakulangan na pwede po nating punan at ano po yung ating pong direksyon para dito? Tapos yung pangatlo ko po ay with regard to the inclusion of the PNP, although yun nga, huli po tinanong yun, at yung sabi niyo po ba yung sa human dignity, although yung in relation to human dignity, there are applicable apps po for tracing. Singapore and South Korea has open systems apps for tracing, pero because there are privacy issues at yun nga po yung ini-ensure po natin, ano po yung pwede natin gawin para mas maayos po yung tracing. But yung huli ko po yung sa PNP nga po, kasi there are many instances because of the mindset na sinabi na, magma-martial law style na po tayo, parang prone for abuse, and at saka yung recent nga po, yung dun sa Marikina, na nag-feed lang po yung bayan volunteers, but meron po silang parang signage na ano pong gagawin para dun sa mga mahihirap. Yung mga ganun po ay hinuli na po sila ng police. And even with the intervention of Mayor Marcy, ikukulong pa rin sila at bibigyan po sila ng charges. So yung sa PNP po, how can we help parang yung transform the mindset of the PNP that this is a health problem, not a security problem, and they should recognize and uphold human rights every time. So yun po yung kay Yusek Herrera. Meron din po akong tanong, pero mamaya na po yung kay...
ma'am, sige. Babalikan po kita, ma'am, if we still have time. Yusek, please.
Yes, actually sa haba, nalimutan ko yung first 2. I remember the second one, gaano tayo kahanda sa ating health system. Unang-una, gusto ko lang sabihin, wala naman pong nagiging handa sa mga ganitong klaseng pandemya. No? Yun ang lagi naming sinasabi. Kahit po yung pinakamayamang bansa, nakikita po natin kung ano ang nangyayari. Dahil alam po natin na ang ating kalaban ngayon ay hindi natin nasisiguro. No? Napaka-uncertain, walang determined and concrete na mga ebidensya na magsasabi sa atin lahat-lahat ng kailangan natin. So ang ating ginagawa ngayon ay continuously trying to prepare po tayo. Ano po ang mga kailangan pa natin for our health system? Marami pa po sa katunayan yan. No? Atin pa hong pinag-iigting ang ating mga pagkuha ng additional health human resources, no? So we have this emergency hiring dahil gusto po natin na magkaroon tayo ng layers of replacements sa ating mga ospital dahil alam naman po natin na very risky and sila po yung prone talaga na magkakaroon ng infection para napapalitan natin kung may naka-quarantine at kompleto pa rin ang cadre kung sakasakali. Pangalawa po, of course, equipments, no? Yung ating mga equipments like ventilators, like RT-PCR machines for testing, lahat po na yan ay kinakalap natin ngayon all over the world. Ang pinaka-critical pa nga ay supplies yung supply sa laboratorio dahil lahat po ng bansa ngayon nagko-compete para magkaroon yan. So tayo po ay pumuposisyon para magkaroon ng mga ganito. And of course, ang atin laging sinasabi, no, itong pong mga facilities natin, no, for quarantine. Sa ngayon, hindi pa ganun kapuno ang ating mga facilities. But we are looking at kailangan paghandaan kung sakaling dumating tayo dun sa punto na mangangailangan tayo na mas madami, kailangan magiging handa tayo. And of course, this would be, local governments would play a very, very big part because of this network across their respective areas para maisagawa natin ito lahat. The first question would be, ma'am, can I just have a gist of that?
Ma'am, your audio.
Yung sa whole of government po kasi, parang nakadichotomize po yung responsibilities and roles of different layers. Yung sa policy making and standard setting, national government. And implementation po, yung local government. So paano, ang ano ko po ay, pwede po ba yung kung we are thinking of whole of government, kasama na po yung local government even in the policy making?
Yes, ma'am. Very much recognized, and that is really part of what we do. In our interagency task force at the national level, we have the DILG representing the local government. So alam niyo po si Secretary Anyo and together with all of his cadre, no, sa DILG, very much po na ipinaglalaban niya ng local governments diyan at lahat po ng kailangan for local governments. So assured po kayo sa national. Kaya po nagbuo rin tayo ng Regional Interagency Task Force. At dapat diyan po ay magkaroon din ng representasyon ng ating mga local governments through the DILG. With regard to specific LGUs joining in policy making, we are doing that naman po. We always do that consultation and also sitting down with them just to discuss like this kind of fora na sana nakakatulong din po sa mga local governments. But definitely we find and we recognize local governments to be very, very important in drafting policies, planning and doing strategies kasama po ng national. The third question, if I may, ma'am, no, sana wag masamain ni Yusek Malaya. I think DILG can very well answer this third question. But as to the health perspective, kami po ay nakikipagtulungan with DILG, with the local governments para bigyan ng protocols na tinatawag, no, kung paano sasama ang PNP, ano ang kanilang role, ano ang mga ating pamantayan para makagawa ng maayos na contact tracing. And the rest of the question, I think Yusek Malaya can very well answer. Maraming salamat po.
Thank you, Yusek. I don't know kung nandyan po si Yusek, if you want to answer the question. Yusek John. All right. Anyway, maganda yung question on the whole of government approach, ma'am, ano, na we have really to integrate the local government units na ginagawa naman po natin. Kasi right now, may mga mayors po tayong nandyan sa platform. Si Mayor Davoco of Basud, Camarines Norte po, nandyan. And Sir Alex, may isa kang question very briefly po para we can end before 12 so that you'll not be able to skip your lunch. Sir Alex?
Very. Hello.
Sir, can you fix your audio? Okay, thank you.
Thank you. I guess many of the questions have already been addressed, but if I were to ask Yusek, looking back, ma'am, you've been very prominent in TV and we appreciate your being open and providing us information. Looking back, ma'am, what would be the major lessons learned over the past 2 months? Because obviously, as Lisan pointed out, nobody really expected this. But anong major lessons learned from the Department of Health? Kasi napakaganda yung framework ninyo, yung sinabi ng enabler, local government-led, people-centered, at alam natin yung quote-unquote conflict between DOH and Marikina, but of course you're able to do that already. So if you were to look back, ma'am, what are the major lessons learned? We have students of public administration from all over the Philippines listening. So I'm sure this is a governance question, ma'am. And you, as one of our top executives facing the public, would really be able to let us know, in reality, in public administration, lessons learned given this quote-unquote black swan, as Lisan mentioned. Thank you, Yusek. So good to see you, ma'am.
Salamat po, sir. No? So, magandang tanong. Ayoko pong sabihin na lessons learned because we regret to have not done it. But gusto kong lang ibigay na lessons learned as we do things every day. Lessons learned na nakikita po natin ay naikukumpara natin ang ating response with our previous day's response. And lessons learned na nakikita natin yung response natin ikukumpara sa ginagawa ng ibang bansa. Unang-una po, ang pinakamalaking lesson na atin pong natututunan dito sa ating ginagawa ngayon, hindi magiging pare-pareho ang response ng bawat area. Whether it be per country, whether it be per region, whether it be per city. That's the first. I think that's a big lesson kasi hindi ko pwedeng gayahin ang ginagawa ng Amerika dito sa atin. Hindi ko pwedeng gayahin at sabihin ng mga tao, bakit ang South Korea nagagawa nila yan? Dito sa atin, hindi natin yan magawa. Hindi natin pwedeng sabihin na bakit ang National Capital Region may ganyan na ginagawa. Bakit doon sa BARM hindi natin ginagawa? These are things that are quite important when you do governance because as we have said, hindi po lahat yan pare-pareho. May mga kanya-kanya po yung inherent na pagkakaiba-iba. Pangalawa po, napakalaking lesson para po sa atin lahat dito sa Pilipinas ang sinasabi nating whole of government, whole of society, and whole of nation approach. Dati, lagi lang natin yan binibigkas sa mga natututunan natin sa mga libro, na pag-uusapan sa mga seminar, pero ngayon nakikita nyo po at na talagang we can really say and we are overwhelmed actually in DOH sa pagpapasalamat pa lang, no? Alam niyo po ba na sa pang-araw-araw na ginagawa namin, ito pong mga malalaking kumpanya at malalaking tao, kausap po namin sila. Hindi ho namin sila tinawagan para tumulong. Sila po ang lumalapit sa amin. Tinatawagan ho kayo ng napakataas na tao at napakalaki na resources nila. Sila po ang nag-aalok sa ating gobyerno para tumulong. Hindi lang po yun. Makikita niyo po ang response ng local government. Kahit ano po ang ginagawa nila sa ngayon. Whether it be small, whether it be big, whether it be not part of the protocol, but still you are seeing how they care for their constituents. And I think that's so important. Napaka-importante po niyan para sa isang response para magkaroon ng success, hindi po ba? Dahil nakikita natin ang response at saka yung appreciation ng ating local government sa mga ginagawa po nila for this response. And I think the third one, which I think is very important, no, in all aspects of what we do is talagang hindi nyo po matatawaran ang paghahanda. Tayo po lahat ay nagulanta nung end of December na nagsasabi na may nangyayaring ganito sa China. Tayo po lahat ay nagulanta nang sinabi na may positibo na sa Pilipinas nung katapusan ng Enero. Tayo po lahat, kami sa gobyerno, tuloy-tuloy na naghanda. Baka po ang alam nila, tumigil tayo kasi walang for 1 month na wala. Pero tuloy-tuloy tayo. Pero kahit ano po ang gawin natin, yung paghahandang yun, parang hindi tayo dumadating dun sa handang-handa na tayo. Kasi alam nga po natin na hindi natin kilala at hindi natin alam ang kalaban natin. So napakalaking lesson po, yun talagang adequate preparation even without a pandemic. You should be prepared. You should be capacitated. At dapat nakikita po natin lahat ng bagay na ito in all aspects, no? Kapag tayo ay nasa normal na sitwasyon. And kasama po dyan sa paghahanda na yan, alam niyo po ba, ang pinakamalaking lesson din sa atin, ang hindi pagbibigay importansya sa non-COVID patients. Isa ho yan sa lumalabas na mga ebidensya sa ngayon. Even in other countries, you'd find. In the US, they studied, no? Pinag-aralan po nila yung mga namamatay doon. And about 40% of those who die in US are non-COVID patients. Why? Because they cannot access services. So I guess this is my takeaway message to all of you. We have COVID, yes, but we still have non-COVID patients that still requires our attention. So yun lang po, sir.
Maraming salamat, Sir Alex and Yusek. Ma'am, may isang tanong na lang po kay Mayor Adrian Davoco po from Kamsur. Mayor?
Hello po. Norte po ako, Camarines Norte po. Actually po, my question is, should the LGU prepare a budget for the procurement of any test kits, may it be rapid test kits or the RT-PCR, or should we just focus on the isolation of PUM and the suspected, confirmed, and probable? And meron po kasi mga cases na more than 14 days before na lumabas. Hanggang kailan po ba namin sila hindi pwedeng palabasin sa bahay? If they have undergone 14 days quarantine.
Yes, sir. Unahin ko yung tanong mo po sa huli, no? Magandang umaga po sa inyo. Yun pong ating mga pasyente, hindi natin pinalalabas because of quarantine. As long as they have finished their 14 days quarantine sa kanilang bahay, yung self-isolation na tinatawag natin, at wala na po silang simptomas o di kaya hindi kahit kailan nagkaroon ng simptomas while doing quarantine, they are already eligible to get the certification coming from their municipal health office or city health office that they are cleared at they have good health. So yun po, kung sakali na meron kayong testing, maganda rin na matest sila kahit na yung rapid antibody test, magagamit po natin yan to discharge patients from our community quarantine facilities. Isa po yan sa gamit natin. So kung tanong yung sa local governments, do you need to prepare budget for testing or you just focus on the isolation facilities? Equally important po ang testing at isolation facilities. We need to do test, and test, but we need to be prepared that we have isolation facilities kung saan doon natin ilalagay ang ating mga pasyente. Now, kung ano po ang kailangang biling na test? Una, yun pong sinasabi natin na RT-PCR, kung kayo po ay merong laboratorio na malapit dyan sa inyong lugar at makaka-tie up po kayo dun sa laboratoryong yon. Ito po yung mga lisensyado nating COVID testing centers, maaari po kayong bumili ng testing kits nyo at ibibigay nyo doon para lahat na lang ng inyong mga constituents na pupunta, gagamit sila doon sa COVID testing center na lisensyado. Maaari kayong bumili. Pangalawa, yung rapid antibody test po, hindi po pinagbawalan ang local government na bumili nito para sa kanilang paggamit. Kaya lang, sinasabi pa rin ho natin na yung protocol pa rin sana po ng Department of Health ay masunod kapag gagamit tayo nito.
Okay, maraming salamat, Yusek. And i-wrap up na po natin kasi magti-12 o'clock na, no? It's time for lunch. And siguro major lesson learned natin is really pagtulong-tulungan po tayo sa pagpalaganap ng tamang informasyon. Kasi through knowledge sharing, we'll be able to cope with this global health crisis. So I'd like to thank Yusek Vergere, Dr. Olga of Parañaque City, Dr. Herrera of Marikina City, and to our actors and also to our participants. Madami po sanang gusto pumasok, kaso lang dahan-dahan namin po kayong pinapasok because of some technical difficulties that we are encountering right now. So, bago po tayo magtapos, kindly go to your gallery view. Magkaroon po tayo ng quick group photo. I think si Miss Pam will tell us kung okay na yung ating group photo. Maraming salamat po sa inyo lahat from Indonesia, Germany, US, Thailand, Taiwan, and from local government units, universities and colleges. Until our next webinar po, we'll keep you posted po. Maraming salamat. Thank you everyone. Have a good lunch.
Thank you po. Salamat po.
Thank you, Lisa.
Thank you everyone. Thank you, Sir Alex.
Thank you
Thank
po.
you, Yusek. Yusek, it was great to meet you, Yusek. Thank you.
Thank you.
Thank you po.
Thank you, ma'am.
Thank you very much, Lizan. Sayang ko lang ang oras.
Thank you po.
Thank you po.
Thank you.
Thank you sa lahat. Thank you, Lisan.
Thank you.
Thank you po din.
Hi, Ma'am Fe.
Thank you, everyone.
Sa 3 to 7 class.
Thank you.
Masakit kanina yung buyo. Congratulations on the last one. Thank you so much.
More webinar in the future. Thank you so much for the PSTA.
I think the ASPAP members.
Thank you po.
Dr. Lizan.
Ay, niluto ko.
Lizan.
Thank
Oh, masarap yung niluluto to.
Libre. One tap. Kain tayo ha.